bet. So we're all about Vivir a todo pulmón, which is living life to its fullest. Our work here focuses on serving Latino immigrant populations. As we look back at our 33-year history, we recognize that things have changed a lot in terms of who we serve. And that really became a point of clarity as we carried out this program here in North Central Florida. So for those of you who aren't familiar with our area, we are very rural up here. We're nothing like Orlando or Miami, so this is a unique space in itself. And certainly we have been quite touched by immigration and the shifts of and the quantity of people coming across the border and settling in our area. So this we felt was a very timely opportunity to talk about TB, as we know that many of the communities that we were serving are coming from countries where TB is has a little bit of control issues. So let me just move ahead here. There we go. So a little background is just kind of when we look at CDC information about tuberculosis in 2021, 30% of the cases were actually attributed to Hispanic Latino individuals. And, they're 19% of the population, but boy, it was a slam dunk in terms of their presence in the TB world. Let's be clear, community is disproportionately experiences barriers accessing care and critical prevention and treatment options. And of course, much of that has to do with legal status issues. Our community here is a community in process when we think about it in the largest sense. And so language, rurality, immigration status, and lower education levels are in par with what I think CDC even expects. But don't worry, here in Florida, we're just even more unique than that. So we did a pre-intervention survey. And I talk about that because Vivir a todo pulmón was actually started, I'm saying maybe 10, 12 years ago when we were working with the Southeastern National TB Center. And so, of course, we were not going to expect that materials that we had made previously would still be robust, abundant, and obviously medically correct. So the first thing was to actually see, what does this current community know about TB? And you can see in that first section that we really see that TB, you go to a hospital. Nobody really knew what latent TB was. Many had been tested, they thought, or maybe. Many thought they'd actually been vaccinated, or maybe. And there's just a really great group that believed that Latinos were the least likely of all communities living in the United States to be impacted by TB. So that did tell us that, well, this is still going to be a timely piece. Obviously, we were concerned about the issue of latent TB, as that was really part of our mandate with this funding. And so we knew that we had a lot of work ahead. I want you to know that we combined this with the reality of understanding, just in a brief health survey we had done separately in the 5 counties that we work in, what our community's main challenges were. And so you can see that almost half had barriers accessing medical care. Many had never even had a medical exam of any type in their life. And that really is attributed to the large quantity of Guatemalan and Southern Mexican community members that have entered into our communities here. 73% suffer or have a close family member with whom they're living who suffers from a chronic illness. And we know that health insurance was just obviously, in the majority of our case, not a reality, and limited English proficiency were part of those challenges mentioned in the first point. So as we looked at that, we thought, okay, time to get ready. So we took some materials that we had originally produced with, again, the Southeastern National Tuberculosis Center, and it was a small photonovela. The Rural Women's Health Project has been using photonovelas as one of our key tools for education, because we think it's really important that people see themselves. And as a result of that, all the materials that we produce are produced with community members. So these are the beautiful and bright faces that you see in our state, right? So the material we produce, again, using Vivir a todo pulmón, living life to its fullest, looked at what we need to know about tuberculosis. And of course, using the comments of, think, detect, and treat. To supplement that, we created a calendar, which we had used originally when we developed our Vivir materials, because there's a real nice correlation with the calendar in this kind of a format and what people were familiar with from back home. We knew that a good percentage of those that we would be doing outreach to were newer arrivals. And so we thought that this idea of having a large calendar that they could hang in their home or that would catch their attention in a Latino restaurant or store would be helpful. We also knew that we had to combine tuberculosis with issues of health in general. COVID has really nailed everybody, but in terms of information education, we have learned very concretely the community doesn't want to just hear about one thing that has nothing to do with them, they think. They want to know about what seems most real, and those are obviously chronic illnesses. So we created this calendar. And then the supplemental piece was the development of the little fotonovela in Canjobal, which is one of the languages, is indigenous Mayan languages that we find most commonly in our area. So we carried out outreach. We believe and we know that the lifeblood of our work are our promotores de salud, or our community health workers. And so we had 5 working with us doing intentional hour-long outreach to 10 people per month for 5 months. When I say intentional is because our promotores in their training learned about what puts people at greatest risk. And we knew that many of our community members had been living in group housing on both sides of the border, right? So prior to crossing the border, living in safe houses, living in detention centers, and then the same here, or people working as farm workers, which is a great majority of those that we serve. We knew that those were some of the key risk factors we were concerned about. We also included the calendar distribution carried out and distributed by the promotores in the places where they have relationships, because all of our work is focused and based on the idea of being trusted messengers. And we documented, of course, the responses of all of our contacts. You'll see here our contact sheet. It's in Spanish, but basically what we like to do is collect, of course, data. That's what we all need to learn more. But we also kind of make sure that each promotor is promoting and presenting the same kind of information. So we give some of introduction, a little bit of the same questions that we ask. And it allows us to make sure that everybody's receiving the same information, because we have had experiences where people said, well, that's not what I learned. So we want to make sure that we're doing everything possible to make sure that people are receiving similar information, even if they spoke to a different promotor. We also wanted to collect data so that we could understand what people do know, what they learn, and that helps us to make sure that our work and our education is appropriate for those that we're training, the promotores, as well as the community itself. So we, in those 5 months, had direct contact with 350 people. The majority of those people were through this one-on-one education with a community health worker. This work was spread over 6 rural counties, and we had the opportunity to speak with individuals from 13 different countries. I want to highlight Guatemala and Cuba because when we talk about lessons learned, we're going to see a little bit of some different data at the end than what I showed you at the very beginning of the presentation. When we looked at our median, we had people here from 8 years as the average, but let me be clear, we had people that had crossed the border a week before, and we also had people that had been here for much longer. The majority of our people are farm workers, and that can be pine straw, that can be in the horse farms, but this idea of being more grounded in ag. Half of the people have less than a middle school education. So that helps to give you an understanding of why we believe in fotonovelas and imagery that people can relate to. And then additionally, a little bit more than 5% of the speakers were indigenous speakers. And what you'll find out is interesting is we thought it was going to be Canjobal, but instead we actually found speakers of other languages in greater abundance. So what are just key findings? I mean, let's just talk about the really important stuff. 97% of those 350 people walked away having learned something new about transmission or risk factors. So for us, that felt like a victory, as we recognize in our state, there is very little work being done around tuberculosis, even with immigrant populations. And then, of course, 65% reported that they became more informed about latent tuberculosis. And of course, that makes us happy, as that was one of the points of focus that had been altered in our original piece to the newer piece that we used for this intervention. So what are some conclusions? Okay, let me just say, health inequities are abundant. This became clear even as we looked more in detail and we had responsive people interested in being tested. Though there is a national focus on latent TB, it is not a Florida Department of Health priority. We are in a very conservative state, and I know a lot of you guys are in California where things are a little bit better off. Free TB testing actually was impossible, right? They would only assist our health departments, those who are symptomatic or having recently been in close contact with an active case. And that created huge problems, though thankfully we learned about that very early in our process so that we could help work around that. Again, as I mentioned, rurality is one of the greatest challenges in our area. Imagine that people had to travel 80 to 150 miles round trip to get to the largest county, which is where our offices are located in Alachua County, for any kind of services, whether those were paid for or not. The community members respond to promotores and to popular education strategies. So we were using a fotonovela tool, which, as I said, we've used for 30 years. But as we look at the very specific piece that we recreated for this intervention, it was still well received and appropriate for many of our community members, especially that were lower education. Though we did also find that it was pleasurable reading and informative for those who had been here for multiple years or those who had higher than middle school educations as well. And the last is that the continuation of new arrivals really requires more assistance and support, not only for the continuation of the outreach that we provided, but certainly testing access and then, of course, treatment for those that test positive. So when we talk about lessons learned, I think in summary, what I can say is that Florida is way behind the curve when it comes to TB and recognition of the challenges and the potential impact this could have for a quick explosion of cases because of how people live that we serve. Secondly, it helps us to recognize that popular education, low literacy, one-on-one education remains key approaches that I encourage people that are working with the Hispanic Latino community, especially if they're new arrivals, continues to keep in mind. And of course, the last, that we all have challenges in terms of policy work as we reach out to other, I think I'd say, allies that we have here in our state to see that we help to prioritize tuberculosis as an issue of concern. So that's pretty it. That's it, y'all.